session 3, which will be introduced by Dr. Park, if she can hear me.
Yes, hi. Good morning. In this session, we will discuss the clinical impact of COVID on patients with breast cancer. And as a reminder, please send all questions through the Q&A Slido window if you're joining virtually, or the Slido app if you're in person. So the first speaker is actually already on the podium. I can see Dr. Maryam Lustberg. She's an associate professor of medicine and director of the breast center at Smilow Cancer Hospital and chief of breast medical oncology at Yale Cancer Center, among many accolades. She will discuss the challenges in breast cancer supportive care during COVID-19 and beyond. Dr. Lustberg.
Thank you, Dr. Park, and thank you everyone for joining this session. So my objectives will be to broadly reintroduce to you the concept of cancer supportive care, discuss the barriers and successes that we have experienced as a community before and after COVID-19, and talk about a few steps moving forward in terms of how we can better support all cancer survivors, all stages, all types of breast cancer during and after the pandemic. So cancer supportive care, what is it and how are we doing? So first, the definition, which is supported by the International Organization of MASC, which is supportive care is the management of the adverse effects of cancer and its treatment, and this includes management of both physical and psychological symptoms, and it requires multidisciplinary care focusing on rehabilitation, secondary cancer risk reduction, survivorship, and end-of-life care, and anything that comes in between. And these are all integral to supportive care. Cancer supportive care is meant to be a broad, inclusive, all-encompassing umbrella of care that includes both patients treated with curative intent, as well as those who are being treated, however, having incurable disease. And it's really a team sport with the supportive care team being comprised of oncology teams, primary care, allied healthcare professionals, as well as palliative care. Talking specifically about breast cancer, when I think about cancer supportive care in this specialty, I think about 3 broad areas that come up very often, and these include toxicity management, psychosocial support, and rehabilitation. And these are important for all breast cancer stages, ages, and subtypes. And talking about these 3 separate areas, which are very interlinked, if you can think about any side effect or toxicity in your head as you have experienced them or as you've taken care of patients with breast cancer, you know that patients with breast cancer have very diverse needs, and they often require multidisciplinary services and coordination of care. And these include oncology, primary care, often subspecialty follow-up in the realm of toxicity management, in terms of psychosocial support, counseling, peer-to-peer support, support groups, as well as access to certain specialty services such as focused interventions and psychiatry. Rehabilitation is also a very significant component of breast cancer care, including physical therapy, occupational therapy, cognitive behavioral therapy, and specialty services such as pelvic floor therapy. So prior to COVID, how were we doing? I think we were certainly aware of the need for cancer supportive care in breast cancer. However, even before COVID, there were still implementation issues, access issues, and disparities issues. So what happened during and after COVID? We know that cancer systemic therapies were significantly impacted by COVID-19, and as you can see by this work previously presented in ASCO Quality, that there was a significant impact on systemic care delivery in close to 1/3 of patients, and certain groups, including Black patients, were more impacted during COVID due to widespread disparities in care and racism. Additional things that happened during COVID regarding cancer supportive care is due to prioritization, understandably, of acute care needs, there was actually also an acute hold of many supportive care services. In addition, visitor restrictions very much significantly impacted patients and families and led to increased distress and need for psychosocial oncology services. There was definitely more limited access for symptom burden management, with a hold in many centers across the country and globally for acupuncture, massage, and in-person support groups. However, as Dr. Pat mentioned, there was also a silver lining, and that was increased telehealth access. With the CMS expansion of telehealth services, with lifting of geographic restrictions, new provider restrictions, and lifting of supervision requirement, there was a boom in our ability to offer supportive care to cancer patients through telehealth. So in breast patients specifically, there was a huge shift to follow-up care being delivered in virtual appointments and with remote consultation. In certain centers, there was also a shift towards symptom management and monitoring being done remotely. And it often led to reasonably high patient satisfaction. Looking at the third largest cancer center in the US, for example, although hardly any telehealth services were being utilized prior to COVID in March of 2020, as you can see in the blue bars, there was a definite shift to increase utilization of supportive care telehealth services after COVID-19. Similarly, in Yale Cancer Center, there was again a shift toward increased video and phone visits in both survivorship as well as palliative care visits. So when this study asked patients as well as providers what types of cancer support services were they willing to recommend or participate in by telehealth. And you can see in this plot that there was a range of services that were actually acceptable to patients and providers to be used by telehealth. We're not a homogeneous community, and certainly patients and different providers could have very different preferences, but in general, a range of services including nutrition, financial, navigation, support groups were favored to be possible by telehealth. Things that got the lowest ratings were end-of-life discussions and end-of-life care, which is understandable. Patients with breast cancer are generally satisfied with telehealth, and in this study from Europe, where many of the visits were in follow-up of patients with breast cancer, the biggest worry was the lack of breast examination during telehealth visit, but overall general satisfaction with these visits. Another study further looked at reasons for survivor satisfaction in these type of supportive care visits. And generally, patients felt that telehealth improved their health care access, saved them time and travel, and possibly saved them money. The biggest gripes were related to technology and not having reliable access to the technology links, access to a reliable smartphone or internet. Speaking more globally, this study was from Mexico, looking at how telehealth was delivered in terms of palliative and supportive care, and similar themes continue to surface, and they all tend to be related to technology concerns. Over half the patients, however, were satisfied with the telehealth intervention. The biggest issues were related to video and audio quality, as well as poor internet connection. You can have all the technology in the world, however, but if different sectors of our community cannot access them reliably, then we need to really come together and really look at how our access issues are really being addressed. And in this most recent study, older patients, Black patients, as well as rural patients had definite less access to telehealth services. So how can we better support cancer survivors during and after the pandemic? This slide is based on the largest CCC19 registry that you will hear more about from the next speaker, Dr. Dimpy Shah. The breast patients were actually the most represented in this study. And we have really good data in terms of what COVID-19 symptoms look like acutely in our cancer population. But what happens after COVID-19? We are just beginning to understand what has been dubbed the term dual survivors. Patients who have survived COVID-19 and also have a cancer diagnosis. And we're just beginning to have data incoming, and there will be several important publications coming up looking at the experience of dual survivors and how long COVID syndrome, which can include symptoms of fatigue and persisting issues, including pain and cardiac issues and myalgias, how does it actually look like in the cancer survivor population, and how can we best deliver cancer supportive care to these dual survivors? As Dr. Pat mentioned, telehealth and symptom monitoring will be a huge area of progress in cancer supportive care in the coming years. And as we have better continuous monitoring of our patients' symptoms, we will be able to better identify cancer supportive care gaps and then design better interventions. This was a multidisciplinary international group that put together recommendations for cancer survivors and COVID-19, recommendations for the path forward. And it relies on increasing patient and public awareness of different symptoms that may be worrisome that patients need to report and come in for. Telehealth absolutely has a place. However, there's also, we need to be cognizant of certain patients and certain clinical conditions needing in-person visits, continuing to look at addressing psychosocial needs, and also addressing financial impact of COVID-19, which has hit hard many of the cancer survivors in our communities. Additional recommendations include improving triaging of cancer survivors' immediate needs and long-term needs, continuing to build an evidence-based framework for telesurvivorship care, and really looking at alternative models of care and decentralizing care. Everything does not have to be in a central hub in an academic center, which can be quite challenging sometimes to access for many patients and communities. So in summary, the pandemic has led to significant challenges with cancer supportive care. However, there definitely have been silver linings as well, including telehealth, telesurvivorship care, and telesupportive care. And these can definitely complement the usual care of our patients. Due to the acuity of how these changes happened, understandably, many of these programs were often created in real time and were often untested. So the next front will be really looking at the evidence behind these implementation and learning from real-world data, as well as carefully designed studies in terms of how we can better improve on the successes that we had during COVID. And really, it is an opportunity for us to think about how the future of breast cancer supportive care might look like and should look like, including more patient-centered care and improving access and equity and reducing disparities. And I'll end with this quote, which is, everything we do before a pandemic will seem alarmist, and everything we do after will seem inadequate. And this is back from 2007, prior to COVID-19, and I think it's relevant still today. Thank you so much, and I'll take your questions at the end.